ADHD is one of the most treatable conditions on the planet. It has a number of different therapeutic options that all work. There was a huge study that was done at the University of Massachusetts 10 years ago, referred to as the MTA study, the Massachusetts Childhood ADHD study. And what the study showed was that if you take children that have been diagnosed with ADD or ADHD, that 90% of them can be effectively treated with one of three modalities, either medication, behavioral therapy, environmental therapy, and or dietary changes. And a lot of parents really want to talk about all these options. They don't necessarily want to put their child on medication, although medication certainly works very well. And so we talk about the behavioral options, the structural changes, the things they can do in their home, and things they can help with the school to really help their child perform and function at a better level. The dietary changes typically are very simple. Sometimes in our current world, they're hard to institute. And children obviously don't always want to eat what we want them to eat. But there's a lot of really good dietary changes that can help children with the way they behave, the way they function in school, and their learning and their ADHD symptoms. There are a lot of what I call myths of ADD, the myths. And those are things like, that ADD or ADHD means that your child is not very bright, and that's not true at all. Another myth is that the medication is addictive or dangerous, not true at all. In fact, the medications for ADD and ADHD are one of the safest medications around. There's no long-term side effects. The medications can be taken daily or just on school days. And again, classically, they are very, very effective. There are some side effects that typically we work through, but we talk about those in the office and how we can best treat your child with whatever the best modality is. If you really feel that your child is struggling, is diagnosed with ADD or ADHD, or may have ADD or ADHD, we would love to help you. I am passionate about treating ADD and ADHD and helping children do better in school, in their home environment, and just overall in their life. And so we really would like you to call, make an appointment, come in and see us, and we'll work through all the details of whether or not your child could be helped.